Todd Ellerin, Director of Infectious Diseases at South Shore Health, to talk about COVID-19 as he does so well each week. Doc, great to see you. Half maskers, I mean, why? Do people think that this is better if they're wearing it half masked?
Ed, so very quick anecdote. A patient at one of the hospitals that I work at just was tested and was found to have 1 billion copies of virus from a nasal swab.
Wow.
Just to give you a little perspective, we need to cover the nose.
That's a succinct answer right there.
Right.
Boston Mayor Marty Walsh just announcing today from October 31st, he's going to extend that outdoor dining by 2 months to December 31st. Eating outside has been successful, yes?
Definitely. So study from Japan looked at about 11 clusters, 110 patients that came down with COVID-19. What they showed was, and they knew about 1/4 of the patients who started these outbreaks, you were 20 times more likely to be outdoors rather than indoors. That's a major relative risk. In medicine and science, if you have a relative risk increase of 2 or 3, that's big. So 20 times the increased risk. We want to keep things outdoors as much as possible.
But let's talk about recent studies that have shown that there have been no cases where the virus was spread through food preparation or packaging. So what do you think restaurants will need to do to reassure customers and public health experts that it is safe to eat indoors?
So that's right. You know, we're not seeing transmissions through fomites or on packaging. We think most of it's respiratory. I think the key right now with restaurants is also really optimizing their ventilation systems. We want to make sure that air is circulating at least 4 times an hour, exchanging to the outdoors, and put in more filters. I think that's really going to protect us when we go back in.
And you know, Doctor, teachers have spent a lot of time planning for schools to reopen this week. And then they see these plans derailed in at least 2 communities that we've been reporting after students allegedly partying together. They're not wearing masks. They're not social distancing. So then they have to shut everything down. So as a public health expert, what's the answer here? How do you explain to teenagers what's at stake?
You know, this is really tough. Maria, you know, one of these communities is where I live in Dedham. So this became one of the hot zones. So I think the key to note is my behavior, what I do affects you. How your behavior is will affect me and the rest of the community. Remember, it starts as individuals acquiring the virus, then you get clusters, and then after that, widespread community transmission. We have to test, isolate, quarantine to keep this down.
And take it seriously, because it is truly has to be handled that way. Doctor, it's great to see you.
And avoid crowds.
And avoid crowds. Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health. It's always great to have you with us. Be well.
Thank you.
Thank you, Doctor. So we see day number 2, we still see some of that haze out there, Ed.
That is exactly what that is, isn't it?